Well, hi everyone, and thanks for joining this NAASF webinar for Subway franchisees regarding health care and how the legislation affects you as a small business owner. This webinar is part of a series of webinars that NAASF offers to the franchisee community to provide insight and advice to you as a business owner and entrepreneur. First, a few housekeeping items. You'll be on mute unless you have a question. We ask that you type your questions into the question box that's on your screen. This will help us to keep background noise to a minimum so everybody can hear. Also, this webinar is being recorded and we'll be posting it to naasf.org in the next few days. We'll start with our presentation, take some questions, and then we'll share some information on the NAASF Health Plus program in a little bit. We'll take any questions on that as well. And this webinar is planned to run for just about under 1 hour. So with that, I'll turn things over to today's first presenter, Misty Challey, who is the Executive Director of the Coalition of Franchisee Associations, or CFA. NAASF is a member of the CFA, and we work closely together on the issues that will be shared with you today. Misty.
Great. Thank you very much, Ilya, and thank you to you and Keith and NAASF for inviting me to help explain a little bit better what we know right now about the health care law, what the Supreme Court decision said, what the regulations currently state, and really how to prepare. Just a little bit of background on me. As Ilya mentioned, I'm the Executive Director of the CFA, which includes NAASF. NAASF is a great member, and as many of you probably know, Keith Miller is the Chairman of the CFA and has been doing a great job at directing the CFA and our 18-member franchisee association. So thank you to Keith and to Ilya for all your help with CFA. I am also the Vice President of Legislative Affairs for the National Franchisee Association and the Buffalo Wild Wings Franchisee Association, and I'm a registered lobbyist here in D.C. For the CFA, the NFA, and the BWNFA. Obviously, this is the top priority and concern of most of the franchisees I've heard from. So I wanted to help clarify some things, go over a little bit of some of the questions that I've had, and then answer some of your questions to the best of my knowledge. Obviously, the regulations about the employer mandate have not been released, and we're still waiting on that, so there are a lot of things still up in the air. That being said, the first thing I wanted to go over with you were just the main provisions of the law. And that is that the law extends health insurance coverage to the currently uninsured. It places an individual mandate starting in 2014 for both individuals and families. Obviously, of most importance to those on this call is that there is an employer mandate to provide, make insurance available to your full-time employees. As I'm sure you've heard in the news a lot lately, it creates state insurance exchanges, which are to be set up by 2014. And then it sets up some small employer credits, which we will go over very briefly, to help employers who are making contributions to their employees' health insurance plans. The cost of this law, the Patient Protection and Affordable Care Act, the PACA, Obamacare, however you'd like to define it, is quite extensive. The cost has been estimated by the Congressional Budget Office at about $938 billion over the next 10 years, and that it would create over $560 billion in new taxes and tax increases, and over $500 billion in total cuts to Medicare. It does, however, create 16,500 new jobs for the IRS, and I'm sure many other of the regulatory agencies here in Washington, which I don't think is good for the rest of the country, but that is something that has been touted by some supporters here in D.C. And there have been billions more in spending that has been authorized but not appropriated yet, so this is just the tip of the iceberg. Some immediate changes that you've probably heard of is that in six months after the enactment of this law, that the dependents that do not have coverage can be covered under their parents' plan until their 26th birthday. that there will be no pre-existing conditions for those under 19 years old that would bar them from insurance, and that there would be first dollar coverage for preventative care. Now, one thing that franchisees need to know is that starting in 2013, you must report the value of the cost provided on your W-2s. So that is something that you need to keep in mind. This is a requirement that kicks in before 2014. So we need to be aware of that and make sure you're in compliance with that law. 2014 is really the big date to prepare for. That's when the individual mandate kicks in, the exchanges open, Medicaid subsidies exchanges possibly expand, the employer mandate most importantly kicks in, guaranteed issue for no and pre-existing condition sets in, and then individuals can get tax credits from the exchanges for purchasing through the state exchanges. I just wanted to give you a little brief overview of the law in general, and now we're going to focus on the employer mandate of the law because this is obviously the most important section that you as business owners need to be concerned about. And I'm not going to go over the technicalities in the law. I'm sure you've heard them many times in presentations, so I'm going to just give a broad view and then focus on the questions and the issues that a lot of people seem to have concerns about. What I'd really like to focus on first is the full-time equivalent definition of employer mandate, and whether if you meet that minimum threshold, whether you have to provide health insurance and to whom. So that's really what I want to go over right now. So first, all small businesses are exempt if they have less than 50 full-time equivalent employees, which is different than full-time employees. So at the next slide, we're going to show you how to calculate whether you meet that threshold. If you do, you must provide minimum essential coverage just to your full-time employees. So I want to clarify this. Your part-timers are included in calculating whether you meet the 50 full-time equivalent employee threshold. If you do meet that threshold, you are only required to provide insurance to your full-time employees. Part-timers are not included in the health insurance mandate. If you do, you have to provide minimal essential coverage. We don't know what that is yet. That is yet to be released in regulations. All that we know is that it has to cover essential health benefits, which have only been defined so far as being affordable and adequate. Affordable is defined as no more than 9.5% of an employee's income, and that means that the employee cannot pay more than 9.5% of their income for this plan. Adequate is defined as having an actuarial value of at least 60%. That meaning at least 60% of the costs need to be covered by the plan. So to determine whether you meet that 50 full-time equivalent threshold, it's a basic calculation, and I'm sure Ilya will make this available to all of those on this call. But I'm going to go over it very briefly. So to determine your FTEs, which is full-time equivalent employees, you add your part-time and your full-time together. Your full-timers are based on an average 30 hours a week over a month. So that is averaged over the month. Then you add in your part-time employees. Now, just using that 30 hours a month, 30 hours a week calculation, for example, 2 part-time employees working 15 hours a week each is basically 1 full-time employee. Okay, so to calculate whether you hit that 50, you're going to add your total full-time, that is more than 30 hours a week, employees. Then you're going to add the number of hours a week worked by all of your part-time employees in an entire month. Divide that number by 120. If that exceeds 50, you are now over the threshold You're no longer considered a small business owner, and you are required to comply with the health care mandate. Okay, again, just to clarify, because it seems that this is a very big point of confusion. If you meet that threshold, you must only provide coverage for your actual full-time employees, and that includes salaried employees and employees working more than 30 hours a week. So it doesn't matter how they're paid. If they work more than 30 hours a week over an average of a month, they are considered full-timers. Now, if you do not provide insurance or provide inadequate or unaffordable insurance, you will be faced with penalties. These, again, are a little confusing, so I'm going to try and explain them. First, for employers that do not ever offer any kind of coverage and at least one of their actual full-timers uses a tax credit to get insurance over the exchange, that employer must pay $2,000 per full-time employee per year. So you're going to add up all of your full-timers, multiply it by 2,000, and you're going to be paying that to the government. If you offer inadequate or unaffordable coverage and at least one of your full-time employees uses a tax credit for the exchange, then you're going to be paying $3,000 for each employee receiving that tax credit. So that amount cannot exceed the $2,000 discussed above. So basically, you can't be paying more for those penalties than if you didn't provide coverage at all. So the $3,000 is for each employee that is receiving the tax credit. The $2,000 would be for all of your full-timers for the year. Now, the key provision here that we have to keep in mind is that just for the penalty portion, your first 30 full-time employees are waived. So you are not going to pay penalties on your first 30 full-timers for not providing insurance. So what does that mean? That means that you might want to think about keeping your full-timers to less than 30, because even if you do not provide coverage, you're not going to be paying the penalty. Another option that many franchisees are considering are moving their full-time to part-time, which is less than 30 hours a week, so that they don't have to provide coverage to their part-time employees. You can still be considered a large employer if you have an excessive number of part-time employees to put you over that 50 threshold, but you still wouldn't be required to provide insurance to them. Now, this we've heard is kind of a glitch. It was kind of an oversight in the law, so it may be addressed in the regulations coming out. But right now, this is the current law. Now, I've provided this chart for you, and this was actually provided by the U.S. Chamber of Commerce. It'll give you a really good idea on whether or not you should provide coverage and what are the penalties and whether you have to pay penalties if you provide inadequate, unaffordable, or no coverage at all. Just want to briefly go over the small business tax credit. Basically, this is a tax credit for those employers who do not have to comply with the law. They're under the threshold, but they choose to anyway, that they will receive a tax credit. So through 2013, if an employer has less than 25 full-time employees whose average wages are $50,000 per year or less, and they pay a minimum of 50% of their premiums, they are eligible for a tax credit of up to 35% of those premiums. This would max out if you have 10 or less full-time employees with an average wage of $25,000. Now, this goes into a second phase for 2014 and 2015, but it's only applicable for employers buying insurance through the exchange. The credit does increase, but it's only good for 2 years. A couple of other provisions in the law that you need to be aware of. If you have more than 200 full-time employees, they have to be automatically enrolled in a health insurance program. More details will be coming out shortly in the regulations, but you need to be aware of this. Also, beginning in March on March 1st of 2013, you must provide your employees with a written notification explaining the exchanges, the subsidies, the tax credits. I am sure that HHS or the IRS will be issuing a sample notification, but you need to be aware that you must be in compliance with this requirement by March 1st. Another issue that we're actually dealing with right now is the one-year look-back period. So the question is, how do you know somebody is full-time? How do you determine, how far do you look back to determine whether they work 30 hours a week? One of the proposals has been to look back 1 year to determine whether they meet that 30-hour standard. And we'll go into that in a little bit. And then the 90-day waiting period, that is the waiting period for new employees. So if you hire somebody new, you have a 90-day waiting period within which you do not have to provide health insurance. Just, I think, because of the high turnover in the industry, specifically quick service, food industries, we're actually trying to work to get that waiting period extended to comply with the look-back period. Again, that is up in the air, but guidance has recently been issued, which I'll go over very briefly. There is legislation in Congress to repeal both the entire law and just the employer mandate section. I'm not going to go over this very extensively because these, to be perfectly honest, have no chance of passing. With a democratically controlled Senate, it just doesn't have a chance, and even if it did, President Obama has said that he would veto anything that passed his desk that would repeal any part of health care. So I wanted to bring this to your attention. Obviously in the House, the Republican-controlled House, they have voted on this full repeal 33 times. They did it right after the Supreme Court decision, but this is just political grandstanding before the 2012 elections. Very briefly, the Supreme Court decision, I'm sure you're all aware of it. It was a 5-4 decision. You can see that Chief Justice Roberts gave the majority opinion with Scalia, Kennedy, Thomas, and Alito in the minority. They basically said that the individual mandate is constitutional and that the penalty is a tax. So basically, it's kind of backwards, but they can tax you. You don't have to do it, but they can tax you for it. So you will have to pay the penalty because that's seen as a tax and it's constitutional. The Medicaid expansion, however, they said was not constitutional. It was very coercive to the states, and so many of the states have reacted accordingly and not expanded their Medicaid programs. The other question was whether the law was severable, that is, whether if one part of the law was unconstitutional, would the entire law go down, and the court decided it is severable. Now onto the regulations, which is really the focus of where everybody is now, trying to figure out what we're going to have to do to comply with this law. According to Leader Pelosi, in order to pass the bill, you have to find out what's in it afterwards. So pass it first, find out what's in it later, which is really not the way to go in Congress, but out of her mouth. So this is a 2,700-page law, thousands of pages of regulations. We are still obviously waiting on the most important regulations for our industries, those being what are the essential health benefits, what can we do with the exchanges, and most importantly, what do we have to provide as employers to our employees. What I had mentioned earlier, just last Friday, the Treasury released guidance on a 90-day waiting period. That's the waiting period for new hires. The look-back period, that is the 1-year period with which you can determine whether somebody is a full-time employee. And then a stability period, which is basically how long does that last moving forward. If you're determined to be a full-time employee based on the look-back period, how long is that applicable for before you have to look back again? We're still analyzing this guidance. It will be published in the Federal Register on October 9th. Comments are being taken, I believe, through September 30th. So Right now, I wanted to go over a couple of the questions that I consistently get from franchisees, and justifiably so, because of the confusion in the law. So I want to go over them, and of course I will take questions at the end. The first being, can each of my stores be considered separately so that you can stay under the 50 threshold? And basically the answer is no. Under the IRS Common Control Test, if you have 2 or more stores with 5 or fewer owners, collectively owning 80% of the interest, then you are considered a single employer. I know that some franchisees are considering reorganizing. I'm not sure what methods they're using to become an individual employer for each one of their stores, and I couldn't give guidance on that. But generally, you are considered a single employer regardless of the fact of how many stores you own. A lot of questions I get about the McDonald's waiver. McDonald's received a waiver. Even members in Congress think McDonald's got a waiver. That's simply not true. The waiver was only for McDonald's mini-med plans and gave them a temporary waiver for the limits on their plans, just for 1 year and just for their part-time temporary workers. There is absolutely no waiver from the employer mandate in 2014. They still have to comply just like everybody else. A couple more questions. How much will this cost you? When, unfortunately, we don't know that yet. The regulations, we're still waiting for them. They're expected to be released at the end of the year. All we know is that it has to have a 60% actuarial rate, and it cannot cost the employee more than 9.5% of their income. Second, can you purchase insurance through the exchange? Well, right now it's up to the states. In 2014 and 2015, the states can decide if the smaller employers, that is those with less than 50 or 100 employees, can purchase through the exchange. That is up to the states. In 2016, it is a mandate that employers with less than 100 employees must be able to purchase from the state exchanges. Another question has been via the grandfather plans. Can your plans be grandfathered? And the answer is not likely. If it existed as of March 23rd, 2010 and has not been amended since then, you might be able to grandfather it, but I don't have the exact details. It seems that they're trying to eliminate these grandfathered plans. Is the penalty deductible for income tax purposes? The short answer is no. Another good question, what if an employee has insurance through a parent or a spouse? Do you have to provide insurance to them? The short answer is no, but if you don't and another employee uses the credit to the exchange, that employee is considered towards that $2,000 penalty. So basically the employee is considered for penalty purposes, but you don't have to, you're not required to provide them insurance if they're covered through a parent or a spouse. This is the same standard applies if your insurance is unaffordable or doesn't meet the minimum standards. If it doesn't and somebody goes to the exchange, then you would have to pay $3,000 per employee for whom it's unaffordable. And that's all I have for right now. I'd be happy to take questions and hand it back over to Ilya. I hope this has been helpful for you, and we will certainly, through CFA, provide you with any other regulations that come about as soon as they come about. So thank you.
Thank you, Misty. I do have one question so far, and I'll just read this and you can answer it from there. I have 6 Subway locations. Each one is a different LLC with different EIN numbers. In each individual store, I only have up to 19 employees. Am I exempt from these reforms?
The short answer is no. Regardless of EIN or organization, if you own more than 80% of each one of those, you would be considered a single employer for these purposes. Sorry to be the bearer of bad news.
Okay, another question is, how do you determine who gets the insurance after your threshold?
Well, all of your full-time employees must be provided with insurance after you reach that threshold. I'm not sure if I understand the question correctly. You don't pick and choose which of your full-timers. You have to make it available for all of them.
Okay.
Somebody actually had a question about, the first 30 full-timers penalties are waived. That is true, but it's not true for providing the insurance. You have to provide it to everybody, not everybody minus 30. That 30 number is just for penalty purposes.
Mm-hmm. Okay, here's another one. When does the look back start? January 1 of 2014 or in 2013?
Well, that's a very good question. We're still figuring out when the look-back period starts, if it would start 2013 or 2014. Nobody really knows right now. And it's a very confusing and probably one of the most questioned provisions in this law is when is this going to apply, how long is it going to apply for, and how do you apply it to your new employees. So I'm sorry I don't have an answer for that for you, but I don't think there is an answer at this point in time.
Okay, next question. If we have fewer than 50, I am not required to comply, but if all the other franchise businesses around me qualify, I feel like I'm going to have to offer health care to entice quality employees. Sorry, just shifted. Does that seem to annoy anyone else on the call?
I can't speak for everybody else, but I can tell you that it is a huge concern for those that do not meet that 50 threshold, is that they're going to have to do it anyway because of the competition in the area, that those will go to, they'll go to businesses that do provide insurance.
Okay, next question. Are part-time hours divided by 30 to calculate full-time equivalents, or adding to part-time people totaling less than 40 hours?
You're adding the hours of all of your part-timers. So regardless of their hours, if they work 10, if they work 15, if they work 29, you are adding them all up, multiplying them by 4 because you're figuring out how many hours they're working in a month, and then dividing that by 120 to figure out what the average weekly is.
That makes sense.
Did I explain that correctly? I'm not sure if I fully answered that question.
If the person who asked it can just let me know if you want me to re-ask. In the meantime, another question. If the employee goes to the exchange, although you offer coverage, who determines if this counts against the employer for the penalty?
Okay, if the employee goes to the exchange and the employer has adequate coverage that is compliant with the law, they do not pay a penalty. If the employer provides inadequate coverage, that is that 9.5% of the income, or coverage that has a less than 60% actuarial rate, and the employee goes to the exchange and gets a tax credit to go to the exchange, then the employer pays a penalty. So if the employer is doing what they're supposed to do, complying with the law, providing insurance that is adequate and affordable, and an employee decides to go to the exchange regardless, that employer does not have to pay a penalty.
Okay. If we currently have a 90-day wait where the employee is eligible the first of the month after 90 days, are we able to keep that provision?
I'm not sure what you mean. Keep what provision? Yes, they would be eligible the day after the 90 days runs.
That sounds like what that means.
Okay. It would be a 90-day waiting period for all of your new hires. So insurance would have to be provided after that 90-day window.
And so you think they'd be able to keep that wait period in place, though, right?
Yes, actually, we've been working closely with the Restaurant Association and other organizations to extend that waiting period to greater than 90 days. We have requested that it be a 1-year period so that it can coincide with the 1-year look-back period, but we haven't received any real feedback on whether that would be included in the regulations, and my thought is it probably wouldn't. there might be some sort of compromise, but I don't know if it would be a year.
Mm-hmm.
And Misty, I'm not sure, can you, Ilya, am I live as well?
Yes, you are.
Okay. I think it sounds like maybe part of that question is that their current waiting period is it's the first day of the month after a 90-day waiting period. And Misty, I'm not sure if, I know it's a 90-day waiting period, so you have to enroll the employee after 90 days. I'm not sure if you can wait to the first day of the month after the 90 days or if it can be a mid-month enrollment. Do you know
Oh,
that?
I understand. Mm-hmm. I think it would be, my understanding is that it would be a mid-month enrollment. You couldn't wait after that to have them covered.
Yeah, I've just seen 90 days everywhere. I haven't seen them specified mid-month or if you have to do it the first day of the next month. But we can certainly, when some of these regulations come out, see if they've quantified that in more detail.
Mm-hmm. Okay. All right, great. Another question, if you make it available but some employees don't take it because they do not want to pay their share, what's your liability?
If you make it affordable, if you make it compliant with the law and they choose not to take it, then you're not liable.
Okay.
As long as it's affordable for all of your full-timers.
Okay. Another question, can we split our employees into two different leasing companies, one leasing company with management only and offer full family health care coverage, and the other leasing company with regular clerks with single-only health care coverage?
Christy, you might be able to answer that question a little bit better.
Yeah, I actually haven't heard. It says that they're using a PEO, so it's a shared employer relationship. And actually, I haven't seen anything specific, Misty, on the common control versus a PEO.
Mm-hmm. No, I haven't
That's something
either.
interesting. Well, I would think it probably gets back to, at the end of the day, still the company. And if the company, has got the common control, the ownership, as Misty discussed before, it probably wouldn't matter if you're putting them with two separate PEOs. But we can check on that.
I mean, I would think you could provide, if you reach that threshold via the common control, I would think you could, and I don't know if you could provide different types of insurance based on their, what they do within your company, but I would think as long as it's compliant, it would be okay. But again, Christy would know this better, and we'll look into this. We'll look into that shortly after the call.
Yeah, and I think some of this really gets into, it's because it sounds like the person who asked the question, they're using a PEO for their health benefits versus just going, to a broker or something like that. And the PEO model is a little different because the employee actually is an employee of the PEO and also your company. So that's where it gets a little tricky. And I haven't actually seen anything about PEOs and anything I've read. So it's a very interesting question. So we'll definitely look into it and see if we can find some answers.
Okay, great. Another one, if I have over 50, there's a typo, sorry, if I have over 50, then I have to raise prices, and my one store owner next to me won't have to. This is a real disadvantage. Does this make sense?
It absolutely makes sense, and unfortunately, if that causes you to have to, and we've been on the Hill talking about this incessantly, is that if they have to comply with this, if you reach that 50 threshold, the cost is going to have to come from somewhere else, whether it be higher prices, laying off workers, keeping your employees to less than 30 hours. I mean, this is not the intent of the law, but it is going to be the outcome of it. And so I completely understand that you would have to raise prices. Maybe some other businesses that can better afford these types of mandates won't have to. And unfortunately, for industries as ours, which have lower profits per employee, that is an unfortunate result of the law.
Okay. If you are just under the 50 FTE mark and have under 30 FTEs, are there reporting requirements, and how often do you have to figure this? And then it also goes on to say, maybe I misunderstood, but aren't you exempt from providing coverage for the first 30 FTEs?
Okay. This is where it gets confusing. If you are under the 50 FTE mark, you don't have to provide coverage.
Or pay the penalty.
Right. And, well, if you're under the 50 FTEs. You don't have to provide coverage at all because you're considered a small business. If you are over that 50, you have to provide insurance for your full-time employees, all of them, all of your full-timers. However, the first 30 penalties on the first 30 are waived if you do not comply. So this is why it gets kind of jumbled.
Yeah, and just a little bit on that, I think where it gets tricky is there's sort of two options. So you go through the test, like Misty discussed, to see if you have to comply, if you have 50 full-time equivalent employees. And then if your answer comes back, yes, I have 50 full-time equivalent employees, I have to comply with the law, you have two choices. You can offer the group plan and provide group coverage to all of your full-time employees, which Misty went through that as well, and there's still some things we have to figure out and get the regulations on as far as look back to determine the hourly people to determine when they're full-time. Or you can just go the route of paying the penalty on your full-time employees. And the penalty is where you have the exemption on the first 30. So if you go with the option of providing the group benefit plan, you don't get to exclude 30 people for that. You provide group health insurance to all of your full-time employees. Or if you go with option 2, the penalty option, you pay the penalty on the full-time employees after the first 30. So the 30, that's where you get the exemption.
And as for the second question, which was a great question, how frequently can you reevaluate whether you hit that 50? I don't know that yet. I'm going to actually put on my list to research that if that has been determined. I don't think it has, but in case it has, I will definitely let you know.
Okay, great. Misty, somebody's asking if you can explain specifically what the exchange is.
You know, I really am not an expert in the exchanges. All I know is that the states need to set them up by 2014 and have them up and running. If they choose not to, they can have the federal government come in and set it up for them. But other than that, I really don't know a lot about the exchanges. And in addition, that they have to make the insurance employers, small business employers, that is those with less than 50 or 100, allow them to purchase insurance through the exchanges. And then it would bump up to the 100 employee number. That is, employers who have 100 or less employees would be able to purchase from the exchanges in 2016. But that's really all I know about the exchanges. We haven't really focused on that, so I apologize if I don't have sufficient information on that.
Okay, next question. Are there any benefits to employers having fewer than 50 employees but who still decide to offer insurance, or is there a smaller employer contribution amount?
Well, there isn't a smaller employer contribution amount, but there are those small business tax credits that I talked about kind of at the beginning of the presentation, is that if you have a certain number of employees, you provide a certain plan and you contribute a certain amount to those plans, you are eligible for small business tax credits because you're basically being rewarded for providing insurance when you didn't have to. And those are earlier in the slides, and I'd be happy to go over it with you. And the other thing is that you would have an advantage over your other small business colleagues who are not providing insurance. So it's a great benefit for your employees and maybe incentive for them to work for you as opposed to your neighbor who doesn't provide insurance.
Good point. Okay. If you employ a parent and child or spouse, that child or spouse counts toward the penalty if another eligible employee goes to the exchange, correct?
Correct. It's a little bit confusing. So if you employ a parent and a child under 26, the child chooses to go under the parent's policy, then you don't face a penalty for them not individually choosing your policy. You are not going to face a penalty for not providing insurance to them. What you may face a penalty for is if what you provide is inadequate and somebody goes to the exchange and gets a tax credit for it. Then you would be required to pay the penalty and include them in those penalties. If you do not provide insurance at all, they would be included in that $2,000 per person penalty, both the parent and the child, for not providing insurance.
Okay. Okay, we'll take a couple of more questions, and then I'll turn it over to Christy. Next question is it 9.5% of gross or net? What happens if some weeks it's 9.5% at a holiday, or the other is more or less, so if it varies?
That is a very good question. I don't know the answer to that, if it's gross or net. And I don't know, I believe it's for the year. I would have, let me look that up, because I don't know exactly if it would be gross or net. And actually, it's interesting that you bring that up, because there has been some stirrings here in D.C. that 9.5% is not for the individual employee, but rather his or her entire family income. And so that is a huge burden on employers who would have to figure out what their employees' entire family incomes are, add them up, and figure out if they're paying more than 9.5%. And so that's still something that's kind of in limbo. It's assumed right now that it's only for the individual 9.5%, but I would not be surprised if the regulations came out and mandated that affordable would be 9.5% of family income. So
I can help on that a little bit too, Misty, if you don't mind.
Sure.
Misty mentioned some of these items, obviously regulations haven't been issued yet, but we did just receive, actually about an hour ago, maybe an hour and a half ago now, a couple of new notices that were some of the decisions made last Friday. Again, there's to the end of September for comments before the actual regulations are issued in October. But just real quick reading before the call today, it does say that what is being proposed is a safe harbor that the IRS is going to allow, that you base this on, the 9.5% will be based on the employee's income as reported in Box 1 of the W-2. So that would be, I believe Box 1 is the gross employee's income. So it does sound like it's going to be gross income, and it is just going to be based on your employee's income. So that will be a good thing if that's what's actually the final regulation on this.
Okay, super. I think just in the interest of time, Christy, I'll turn it over to you, if that's okay. Just by way of introduction, Christy Williams manages the NAASF Health Plus program that NAASF offers to Subway franchisees currently. So I'll turn it over to you, Christy. And then we'll take a few more questions if we have time at the end.
Great. Okay, and again, I've met a lot of you over the years at some of the various meetings and calls and things like that. But I do work with the NAASF organization on the Health Plus program that's actually offered through the organization that I work for, National Association Management Group. So Misty, if you could go ahead and go to the next slide for me, please, ma'am. I think you're controlling that. Just one of the things, you heard Misty talk a lot about the regulations and things like that, and there are just so many different regulations that haven't been issued yet, so many unanswered questions. We are absolutely doing everything we can to make sure that our program is staying in compliance with the law as things come up each year. There were things starting back in 2010 that we had to change on our program. So we obviously are working very closely with the Restaurant Association, the U.S. Chamber. Our program is self-funded. So we work with a group called SIA, which is the Self-Insured Institute of America, and obviously SHRM as well. Even the National Restaurant Association, a rather large entity and organization, they went out and hired a separate law firm just to read the law and monitor regulations as it comes out so they can inform their members, what they need to do. So as Misty said, it's a 2,700-page law. It's very difficult to really get your arms around everything, and it seems like every time there's a question and we get an answer, there's just more questions that come as a result of it because so much just hasn't been defined yet. So we absolutely support repealing the law because we know how it affects franchisees, but at the same time, we're just doing what we can to help inform members about the requirements and obviously keep our current plan in compliance. So again, our plan is self-funded. So just to talk a little bit about self-funded versus fully insured programs. And the law does specifically say that there are going to be some exemptions for self-funded plans. Now, like everything else, it doesn't clearly define what some of those exemptions are going to be. One of the things we do know for certain is that fully insured plans will be required to have a deductible with limits no higher than $2,000 per individual and $4,000 per family starting in 2014. We think this is a huge issue. You know, our current program offers deductibles up to $5,000 with a tremendous amount of employers and employees participating in a $3,000 deductible and a $5,000 deductible plan. So obviously, once you're required to offer a plan with a lower deductible, no higher than $2,000, that is absolutely going to add to the cost of your premium. Again, we don't know all the definitions of this, but we do know that there are going to be some, hopefully, flexibility with the self-funded program. Misty, if you could go to the next slide. Can you go to the next slide, Misty? Okay. So currently what the law says is that the self-funded programs are going to have restrictions on them that limits your employees' cost sharing to the non-premium out-of-pocket maximum that's in place for high-deductible health care plans. The word maximum and out-of-pocket maximum hasn't yet been defined. But again, we are very optimistic, and we're speaking with individuals from SIA and other employers who sponsor self-funded plans. We do believe that we're going to have a lot of flexibility to meet the minimum essential benefits, but to hopefully have a higher deductible option, which in turn means we can keep the premiums lower than what these fully insured premium program is going to be able to offer. Again, on the 60% actuarial value and minimum essential benefits, we know the categories for the minimum essential benefits. All of our current plans have coverage for those categories. We just don't know to what extent you have to offer coverage within those different categories, which means you have no idea what the premium is going to be. So obviously we are watching this very closely, making changes as they are defined, and we know what we have to do. But just really optimistic and honestly hopeful for the franchisee community that our flexibility as a self-funded plan is going to allow us to offer something for you to help keep your costs down. So just real quick again on the employer penalties, and Misty went through this a little bit on what the penalties are. If your group sponsored plan, so through the NAASF Health Plus plan or something you're doing on your own, if it meets all the requirements of the law, the affordable, as Misty talked about, and the 60% actuarial value, and your employees still go to the exchange, you don't have to pay the penalty on them. Just want to clarify that because a lot of people get really confused about that. And also in reading the law, which we're doing here in our office, which we found that most people aren't actually reading the law. They're picking up a fact here and a fact there and then talking about it and trying to make assumptions based on that. So we are reading the law. And in our reading of the law, it is very clear that it's the responsibility of your employee to pursue the appropriate government process if they choose to purchase a policy through the exchange. So if you're offering your group plan, they choose to go to the exchange anyway, the employee is going to have the burden of proving through the process, whatever that may be, that is established, that your plan that you offer did not meet the 9.5% actuarial, or excuse me, the 9.5% household income requirement or the 60% actuarial value. We also have some concerns in just talking about the penalties in the exchange. Again, if you read through the law and you read options with the employer actually paying the penalty versus offering a group plan, we're very concerned, number one, about what that penalty is going to be in the future. There's no way that the program, Misty went through the cost of this, there's no way the program can sustain itself on a $2,000 penalty. We're very concerned that penalty will double or even be more than that, 2015, 2016, and subsequent years. But also the latitude that you're giving the government into your overall business operations. Once you make the decision to pay the penalty, send your employees to the exchange to purchase their policies, you have pretty much just opened up everything in your business to let the government come in and audit, analyze everything about your business operations. So again, we have a lot of concerns about that. You as business owners pay your taxes and do other things you're supposed to be doing as a business owner, but you shouldn't have to just open your doors up and say, come right in and analyze everything I'm doing. And from reading the law, that is absolutely what you're going to do if you choose to go the route of paying the penalty. Okay, next slide, Misty. And a little bit more about the state exchanges. Some other things that we've just recently learned with working with our program partners, there are some states already, District of Columbia we know is one, so there's obviously probably going to be others that will be expected to follow this. There are a lot of questions today about, I'm smaller than 50. Should I offer a plan anyway? Will that make me more competitive? My competitors on the street are going to be offering a plan. Should I do the same thing just to keep my managers? we believe a lot of small business owners are going to continue to do that, and our plan absolutely will be in compliant. We'll offer a variety of options for those employers, as well as many other, I'm sure, state brokers and programs in your state. But some states, again, District of Columbia has already written this legislation. Some states are trying to mandate that if you are an employer with 50 or fewer employees, that if you decide to offer a group plan to your employees, even though you're not required to under the law, but if you still offer a group plan, you're going to have to purchase that group plan from your state exchange. Again, we're very concerned about that. Again, just as far as you as a business owner being able to make the decisions you need to make for your business operations. Now you don't even have to comply, but yet you want to be the good guy, be the good employer, and offer great benefits to your employees, and now you're being told where you have to go purchase them. So again, just a very, very concerning part about the law, and maybe now what even some of the states are going to be doing. And if your state doesn't have an approved exchange set up, guess what? Your national government's going to be there to step in, and they're going to have a national health exchange available as well. So, again, just a lot of just kind of questions about this. As we said, the more regulations that are available, the more questions that come up. We are doing everything we can to stay on top of it to make sure the NAASF Health Plus program has options that are available on the W-2 reporting requirements for those members who participate in our program. We already have a report that we're working on that we'll be able to provide to those employers so they can pass that information directly on to their payroll provider. So you don't have to worry about calculating on your own what those premiums have been. But again, just trying to stay as optimistic as we can about it. Research the law, read the law, follow the regulations, and obviously just do everything we can to make sure that our program hopefully is providing a little bit of a competitive advantage versus what you can get from a fully insured option or the state exchange by having that flexibility to self-funded program. So I didn't want to get into much today, like what deductibles we have, what coverages we offer. They're pretty boilerplate standard programs and coverages. But just to let you know that as a NAASF Health Plus program, you do have options available unless your state tries to come in and propose some other type of legislation. And we're going to stay on top of everything for you. And again, just hopefully be able to provide an option for you to keep your costs down as much as you can.
Okay, Christy, can you hear me okay?
I can.
Okay, I was just losing you a little bit.
Okay, so if there's any questions specific about the program, I can take those.
Okay, we have a few more minutes. Let me see if there are questions, and we actually have quite a few from Misty's segment before, so let me just see if I can tackle as many as we can before we have to end at 3 o'clock. So here's just a few more questions. Is the requirement for each company per federal ID number or the owners of the company?
It is not per federal ID number. It's based on that IRS common control test. So even if your businesses are registered separately, organized separately, if you have that common control, you are considered one employer.
Okay. Okay, so to clarify, this is another question. If I meet the 50 FTE standard, do I have to provide insurance for just the employee or the employee and the family?
Just the employees. At this point, it is just the employees, although we've been hearing rumblings about their families. But yes, right now, just the employees.
Okay. Can you provide 2 separate levels of plans, one for executives and management and one for hourly employees? Good question.
That is a good question. I was going to say, Christy can probably answer that.
Yeah, they're actually starting last year. So starting in 2011, there were some requirements in the law that were supposed to go into effect last year that says that you cannot do that. It's non-discrimination provisions of the law that basically said that you can't have, a plan that discriminates, in favor of the highly compensated employees. And there were about 4 different definitions specific to the healthcare law that defined your highly compensated employees. Percentage of ownership in the company, I think the top 20% income earners, of employees for your company. There was a lot of confusion of how to enforce that. To be honest, is what I heard from it. Kind of exactly what it meant, how to enforce it, and who was going to monitor that. So that has actually been postponed. Hasn't been eliminated. They haven't said they're not going to do that, But for the year 2011, and they haven't issued any additional regulations on it right now, you don't have to do that, but I'm sure that, again, that's just another regulation that they're working on right now that will be released sometime between now and 2014. So I guess the short answer is you're not going to be able to do that. It sounds like if you offer a plan, you can offer 2 different deductible options. But if you have just say a $1,000 deductible and a $2,000 deductible, and you're going to pay, it comes out to 50% is what you're going to have to pay to meet that 9.5%. You can't just do that for an executive level employee and pay something different or pay it just on the 2000 plan for your other level employee. You're going to have to offer the exact same contribution for all employees on the exact same plan.
That makes sense. Okay, great. New question. How does it affect, what is the effect if my wife owns a business that I don't have ownership in with 25 employees and I am at 60 FTE? Is she now considered over 50 or are we separate?
I would think it depends how you're organized. If she is the sole owner of her business and there is no kind of common control or any type of varying ownership or shared ownership, I would think you would be considered 2 separate employers.
That makes sense. Okay. Is there a per employee cost estimate for coverage from the exchange?
I don't think we have that information yet.
Yeah, and we don't, and it's just because they haven't defined what the minimum essential benefits are that you have to offer.
Mm-hmm. That makes
sense. So until we know what the plans have to cover, there's really no way to calculate 100% what the premium will be.
Okay. Bear with me 1 minute.
Just, Ilya, in response, that's a very good question about the wife and the husband owning separate businesses. Let me just confirm that. I would think if they're owned individually that they wouldn't be jointly, you wouldn't add the employees together, but let me just confirm that.
Okay. Okay, great. New question. Due to high turnover, it may take 2 or 3 people across the year to fill one typical full-time position. Would this count as 1 FTE or 3?
Well, you would have to at a specific point in time add your FTE's hours together and then figure out how many actual full-timers they count as. I don't think you're going to be required to include, 3 employees who are turning over for the same job. If it's a line cook and there are 3 separate employees who just because of the high turnover are adding up to a certain hour limit, it's at a certain point in time. So you're not going to be adding 3 separate employees who have the same job, if that makes any sense. You're going to just be taking it at some point in time and adding them for their hours worked over a month. Does that make any sense? So if you have, 3 part-timers that are, regardless of turnover, that are working concurrently, yes, all of their hours are going to be added up to determine if you're going to meet that 50-person threshold. If they're not working concurrently, if one is replacing the other and is replacing the other, those 3 aren't going to be added up at the same time to figure out whether you meet that threshold.
Right, that makes sense.
Yeah, and just even on that, it sounds like, again, once we know 100% this look back and stability period, with the turnover, each one of those employees, if you go through the test and you determine, yes, I have to comply with the law, as you have turnover and look at your new employees, you're still going to be able to have this look back period in place. So you can look at those employees, and it sounds like from what I've read just today, what was released, if it's not known in the beginning if they're going to be one of these employees who's consistent and going to average 30 hours a week, you're going to have some flexibility to really look at them to make the determination if they truly are an employee who averages 30 hours. Mm-hmm. It looks like it's somewhere between 3 to 12 months is what the latitude you're going to be given to quantify and determine if that person is truly full-time. So, but then after that, it gets into what Misty called the stability period. So if they go through this process and it's determined, yes, they meet the 30-hour threshold, then they also get a time frame going forward, which is called a stability period, that regardless of how many hours they work, they're going to be considered full-time and you're going to have to offer the insurance to them. So, but again, a lot of that, it sounds like October 9th is the magic day where we're going to have firm numbers on some of this.
Maybe we can regroup after the 9th to touch
Yep.
base. We actually have time for one more question, so I'll read that. Let's get that answered if we can, and then we'll move on. What percentage of the coverage cost can an employer charge to the employee? Would it be 50%, 60%, or what?
Well, I guess the short answer would be it would have to be, and I don't mean to laugh at this. These are fantastic questions. It's just there's so much in the air, up in the air still. The answer would have to be, I guess it depends on whether it would be greater than 9.5% of that employee's income that that employee would be required to pay into the program. So I think looking at it in terms of affordability for the employee is really where they're focused, as opposed to requiring them to pay a certain percentage. If that percentage allows them, if that percentage makes them pay more than 9.5% of their income, then the answer is no. If it doesn't, then the answer would be yes. So, barring any other regulations explaining what affordable is, I think they're really gearing towards that 9.5% of so that's really where I would recommend we focus on.
That makes sense. Okay, super. Well, Misty and Christy, thank you very, very much for your time. I really appreciate it, and I think everybody learned a lot about this great topic. I want to thank everyone for attending and participating in today's webinar. Watch for details on our next NAASF webinar from the U.S. Department of Labor coming later this month. So thank you, everyone, for your time. Have a great day.
Thank you.
Thank you.
Take care.